Hello. I'd like to welcome you to our Planning a Healthier Future Partnerships with a Purpose webinar. Today's panel Hello, I'd like to invite you to the Planning a Healthier Future Partnerships with Purpose webinar. Our today's panel will be moderated by Mike McKeever, Executive Director of the Sacramento Area Council of Governments. And our panelists will be Judy Robinson, the Sustainability Manager for the County of Sacramento, Dr. Olivia Casari, Public Health Officer for the County of Sacramento, and Monica Hernandez, Public Information Officer and Media Communications for Sacramento Area Council of Governments. All of our speakers' bios are available on the webinar software and the ILG website. We're going to start with a short presentation of our case story, which focuses on Sacramento County and the partnership between the plan for active design partnership here in Sacramento County, and then we'll go into a moderated conversation. My name is Julia Leigh Johnston. I am a Sustainability Program Manager at the Institute for Local Government. The Institute is a nonprofit research and education affiliate for the California State Association of Counties, the League of California Cities, and the California Special Districts Association. And we would like to thank CSDA for hosting us in their facilities today. The Institute for Local Government promotes good government at the local level and provides practical, impartial, and easy-to-use materials in a number of focus areas, including collaboration and partnerships, ethics and transparency, public engagement, local government basics, and sustainability. Our focus on partnerships is documented in our Stretching Community Dollars publication, which in its first iteration was worked on by one of our moderator, Mike McKeever. This publication is funded by Kaiser Permanente, and it focuses on how local governments can harness partnerships and collaborations to effectively and efficiently deliver services and leverage existing human and financial resources, and helps local leaders grapple with a variety of community development and public health challenges as they craft and approve policies impacting children and families, including healthy eating, active living, violence prevention, and safety. So our panels today will be talking about how different agencies work together to obtain a shared vision and goal. They'll be talking about the benefits of collaboration in pursuing healthy eating, active living goals, and they'll focus on best practices and lessons learned from their collaboration. So I'm going to turn it over to Judy Robinson, who will give a short project overview for us today.
Thank you, Julia. And I really want to thank Institute for Local Government. We really appreciate the opportunity to be able to be with you today and present the work that we're doing. So the overarching message of our project is essentially find other like-minded people who want to make a difference. And this is how we were successful, and this is how you form successful partnerships and collaborations. And you also need champions. But since I have 10 minutes to give this presentation, I'm going to tell you our story. We all first met working on a transit-oriented development project, and while it was mostly an infrastructure assessment project, we also held community workshops on walkability and bikeability and the related health benefits when you live near transit. We invited our public health officer, Dr. Casari, to participate, and that was when she met the rest of the project team, and the rest is really history. Dr. Casari came to us in December of 2012 and said, you know, we need to apply to participate in this year-long National Public Health Leadership Academy, and we need a diverse team, and that transit-oriented development team that you introduced me to would be great. So we applied, and we were accepted, and the photos on this slide show the trip that we made to Atlanta, where we met with all the other national teams when we were convened for the leadership program. And if you really want to get to know people, take a road trip. So the members of our team shown in the photos here are Adrian Engel, our transportation engineer, engineers. Terry Duarte was a Master's of Public Health and the then Executive Director of the nonprofit Walk Sacramento. Monica Hernandez, Public Information Officer for our Metropolitan Planning Organization, SACOG. Dr. Edie Zussman, a private sector healthcare neurosurgeon. Myself and Dr. Kassiri. So I know why a neurosurgeon. So at the time, Dr. Zussman was working on her MBA and was doing her thesis on the Accountable Care Act before it had actually been adopted. And what she was saying was that healthcare cannot be profitable unless people get more healthy. And so she saw active design as being a way and a key model in getting and keeping people healthy. So this was the beginning of an amazing partnership, and we expanded it when we went to Atlanta and met the other public health teams across the country. And in particular, I want to acknowledge the Michigan team and the New York team who shared with us the New York City Active Design Guidelines and then also introduced us to the Center for Active Design. Once we saw the Active Design Guidelines, we knew exactly what we were going to be focusing our work on. So our project would be to improve health in the built environment through active design. Our success was really built on a series of small incremental steps, strategies, and reassessment. And I should have mentioned earlier, but no funding was provided to do the work or to participate in leadership programs, so we worked this into whatever our daily jobs happened to be and took advantage of the passion that each of us had and used our free time as well. We knew that we wanted to have active design implemented at the most basic possible level so that all development projects would be required to integrate active design into those projects. So that's why we targeted the countywide design guidelines. We also then leveraged different opportunities as they came up to support and supplement active design through policies. And starting with the general plan, we were able to include, working with the planning department, the policies that you see on the screen and others, but the whole goal of advancing a built environment that promotes and supports physical activity and advancing a built environment that has access and uses multiple transportation modes, but really with the goal of healthy communities. So we, working closely with the planning department, proposed policies that were adopted in the zoning code, in the housing element first, and then when the county decided to update the zoning code, then we were able to leverage those opportunities in the development standards that had not been updated in over 30 years at the time. So we proposed policies that further advance health in the built environment through active design, and we came up with an icon, a little walking person icon, that would distinguish the guidelines that were health supporting. And so the icon is located next to each one of the guidelines that advances active design. It was also timely that the Governor's Office of Planning and Research were doing an update of the draft general plan guidelines and including a new optional healthy communities element. We got to work with Dr. Elizabeth Baca at the Governor's Office of Planning and Research, and she's just been incredible and has been amazing in connecting us and others in the work that we've been doing. But one of the challenges was how do you get buy-in from the higher-ups in the organization? And this is something that Dr. Kassiri and I frequently talked about. This is something also that our whole Design for Active Sacramento team talked about. And strategized around, and then also tried to identify what would be some of those small steps to continue to move us in a direction of success. So anyway, one day, Olivia and I were meeting with Olivia's boss, and we were updating her on the active design work that we were doing. And the county exec walks in, and he goes, "Well, what are you doing?" And we're talking about active design and some of this work that we're doing as part of this program, and explained to him what we were doing. And so we told him very casually, and he said, "Oh, that sounds great." Then he walked back to his office, and Olivia and I looked at each other and said, "CEO's been informed." And so again, you just take advantage of those opportunities. And we also used Olivia's position as a public health officer to approach our board chair, who at the time was Supervisor Phil Cerna. we needed a public health champion, and she needed a public health champion, and he also had a planning and development background. So we went to him. Olivia asked Supervisor Cerna if he would be our health advocate, and we discussed it further, and he agreed with that wholeheartedly. And then his first charge as the health advocate was to give a welcoming address at the Urban Land Institute launch of the Building Healthy Places Toolkit. And Phil continues to say yes to advancing healthy communities and is a great supporter. The design guidelines were also being updated with the zoning code effort that the county had undertaken, and the zoning code is implemented through the design guidelines. So, as I said earlier, we created the walking person icon that calls out the health supportive guidelines. We wrote an appendix document that talked about the state of county health, described chronic disease, and really laid the foundation for what active design is, how it supports and works in reducing chronic disease, and the importance of integrating health and land use and transportation all into the built environment design. We also met with our community partners, those who shared common values, and we leveraged each other's work. We have a lot of support from the AIR District and SACOG, of course, but we have other nonprofit partners as well. Breathe California, the California Endowment, Building Healthy Communities, Health Education Council, Kaiser Foundation, the Sacramento Tree Foundation, the list goes on and on. And we worked with each other, and we were each other's partners because all of our work helped each other. These groups wrote letters of support to the Planning Commission and the Board of Supervisors, encouraging them to adopt the use of the icon as well as the related policies and guidelines, and the board took notice. In fact, the board adopted these policies. They adopted the new development code with the design guidelines last July, 22nd, 2015. One other, we had a lot of lessons in our experience, but one of them was never to underestimate the value a white coat brings to the conversation. Oftentimes, we had a champion in our community development director who actually helped us do strategic planning. And oftentimes, we would bring certain things up when we were meeting with her, and she said, well, what's the doctor have to say about this? But never mind what the planners have to say about it. What's the doctor have to say about it? Which was great. And again, it helped build the partnership and greater understanding, and it leveraged both of the departments working together. But when we were briefing the chiefs of staff for our Board of Supervisors as the design guidelines were going forward, we brought Dr. Zussman, our neurosurgeon team member, to meet with the board chiefs of staff. And don't you think they wondered why a neurosurgeon was there? But again, it was very, very helpful in really making the connections between how we do build environments has direct impacts on people's health and their ability to live a healthy life. So why does all this matter? One of the terms that we learned along the way is a term called social determinants of health, and it's a concept and it's a framework that's described by the Centers of Disease Control as factors that contribute to a person's current state of health or lack of health. I added that last part, but the California Planning Roundtable wrote a paper relating social determinants of health to places where people live, work, and play, also defined as community assets or lack thereof. So underneath the surface of social determinants of health concept, it's built upon a substantial body of scientific public health research that supports the notion that our zip code can actually pinpoint how healthy or unhealthy we are. Stress in living in an unsafe or an unhealthy environment directly affects one's DNA, making people susceptible to early onset of chronic disease, mental illness, inability to succeed in school, or hold a job. And this is where public health, public policy, and the built environment, including infrastructure, intersect, and how these areas impact the social, physical, mental, environmental, and economic health of the community and personally impact each of us. This is the why for the collaboration, and people really wanting to make a difference. In mid-May of this year, the president and CEO of the San Francisco Federal Reserve Bank, John Williams, was in Sacramento addressing the Sacramento Economic Forum. One of his messages, and I quote, "Research shows a direct correlation between the quality of a child's neighborhood and income later in life. And if you remember just one number, make it this, 300,000. That's how much more a kid who's moved from public housing into a lower poverty area can expect to make in a lifetime." That's significant. So growing our work after our project, we worked with SACOG, and we were a co-applicant on a Strategic Growth Council Round 3 grant to provide technical assistance on health and the built environment to all the jurisdictions in the region. Walk Sacramento and Design for Active Sacramento has been engaging cities and other counties across the region in not just sharing the work that was done for Sacramento County, but sharing the importance of public health officers and planning directors needing to work together, showing ways that they can work together, doing policy reviews, showing where the intersections of health and planning are. In many jurisdictions, a lot of their policies are already supporting health. They're just not taking credit for it. The Design for Active Sacramento team has provided physicians to testify at planning commission meetings and do planning commissioner training. Also working with developers to improve projects to add health elements into the project to make it more healthy, and so on. But what we're especially excited about is being part of the Plan for Health program. It's an American Planning Association project. It's funded through the Centers for Disease Control. And Walk Sacramento and Design for Active Sacramento is one of 17 teams in the country that was selected to participate in this Plan for Health program. Partnering with the American Planning Association is the American Public Health Association, and here we've picked up even more partners and leveraged this national program for everyone's benefit. So the result of the Plan for Health recognition was to have the opportunity to do very focused work with the Sacramento Valley section of the American Planning Association and the Northern California Public Health Association. And they've been awesome to work with, and they've brought even more others to the table with connections that they've had in some of the work that they've been doing. So the logos that you see on the screen are people and organizations that are doing similar work and are engaged in the speaker series that is sponsored each year between the American Planning Association, the American Institute of Architects, Landscape Architects, and Urban Land Institute. And because of Plan for Health, they've embedded health through every one of the speaker series so that we can talk about it in these different sectors and talk more about where health really impacts architecture and the overall built environment. It's also helping us to advance and implement federal, state, and local policies, and you can also see some of the other state partners, their logos that are up there as well. The relationships and partnerships continue to grow. Dr. Baca with Office of Planning and Research introduced us to Marianne Morgan, who represents the Chronic Disease Prevention Leadership Project that's comprised of California local health officers and health executives across California. And they have done a statewide survey, and one of the outcomes of the survey was the desire of health officers wanting to convene with the planning directors. And when we checked this out with the health officers in the SACOG region, they agreed. So that's what we did. So this particular slide shows a convening that we had May 25th. All of our collaborating partners where we brought together public health officers and planning directors to share ideas and identify areas where they can work together and meet common objectives, state mandates, and ensure that each jurisdiction has tools that they need to be a healthy, sustainable, and vibrant community. Surprising as it may sound, many public health officers and planning directors have never met. And it was an overwhelming success, and by the end of the morning, the planning directors and public health officers had found ways and things in common that they can work together, and they made commitments to work with each other and work together going forward. And speaking of going forward, kind of some of the things that are still ahead is we're continuing to find intersections to build on. One of the exciting things was that we were working with the California Department of Public Health and providing comments to Caltrans as they were updating the active transportation program, and in particular the rubrics for doing some of the scoring. And the health questions that are part of the active transportation program, previously, while encouraging jurisdictions to reach out to their public health departments, didn't award points for doing that. Starting in 2017, that changes. By contacting the local health department and working with them and answering the health questions, will provide, one, an opportunity for people to meet who have never met before. Two, we'll really be able to provide more informed, deliberate information about how a certain transportation project can directly improve and contribute to improving the health of that particular community. But it opens up dialogue where dialogue hasn't occurred before. And this is very, very significant and will, particularly because there's a 2-point difference, at least a 2-point difference, when you do engage with your public health office in answering these questions. And that 2-point difference can make a difference in being funded or not. Also, AB 441 that was adopted in 2012 requires that the next update of the Regional Transportation Plan guidelines also include policies, practices, or projects that have been employed by metropolitan planning organizations that promote health and health equity. That update is currently underway, and there are groups looking across the state ensuring that public health is addressed in a very robust manner during this guideline update. But there's still a lot of groundwork and education that has to happen. And there are a lot of people in many different sectors doing this work, so we need everyone doing this, which leads me to this last slide, climate change. Climate change is one of the most significant threats to public health of the 21st century. The good news is that what's good for health is also good for climate. Sacramento County built climate resiliency policies around healthy community theme, active transportation, mixed land uses, safety, landscaping, which also all help mitigate for greenhouse gases and make our communities more resilient to climate effects, while also improving the public's health. Additionally, Sacramento County is part of the Capital Region Climate Readiness Collaborative, one of 5 collaboratives that's part of the statewide ARCA, Alliance of Regional Collaboratives for Climate Adaptation. They also have a health committee realizing the importance of the intersections of health and climate change and climate resiliency. But this is too big a problem to solve alone, and we need each other. We need all sectors, and each of us has a piece where we can make the necessary changes for the better. So I'd like to close with this quote from Margaret Mead. "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." Thank you.
Thank you so much, Judy. I want to thank you for taking the time to share this really exciting work that you're doing. The Institute for Local Government has really enjoyed working with Design for Active Sacramento and being involved in the Plan for Health project. I want to let our listeners know that we do have a part 2 of this webinar, which is a dialogue between Mike McKeever, Monica Hernandez, Dr. Olivia Casari, and Judy Robinson, talking more about this really wonderful project in Sacramento and the future for this collaboration between public health and planning and the other sectors of our community. So thank you very much. Thank you, Dr. Casari, for joining us.